Good morning and good evening, good afternoon, wherever you are. A 68-year-old client is brought to the outpatient clinic by their spouse for evaluation of changes in daily functioning. Over the past several months, the spouse has noticed that the client sleeps much longer than before, often 12 to 14 hours within a 24-hour period. Despite this, the client frequently appears tired and complains of feeling exhausted no matter how much sleep they get. The spouse reports that the client often drifts off unintentionally while watching television, sitting at the table, or even during conversations. Several daytime naps have become a routine. Although the client generally remembers important past events and communicates clearly, there have been a few recent lapses. Lapses means like not really good, absence, such as misplacing household items and one episode of briefly forgetting the route to a familiar grocery store. Grocery store is like, where you get your vegetables and like normal shops where you get your day-to-day food items and things like that. The client seems mentally slower than usual, taking longer to respond to questions and occasionally appearing groggy or confused right after waking from naps. Now, there's more. The client admits to having less motivation and has gradually stopped participating in hobbies that were once enjoyable. So he's not interested in doing all those things anymore. However, when asked about mood, the client describes feeling mostly tired rather than sad, and denies persistent feelings of hopelessness. There has been no recent illness, fever, head injury, or medication change. A focused neurological examination shows mild difficulty sustaining attention. Physical examination and vital signs are within normal limits. The client worked permanent night shifts as a hospital security officer for more than 30 years and retired about 4 months ago. So now we come to the question, what is going on? Okay, so we have 4 options here. 1 is early dementia, 2 is narcolepsy, 3 is depression, and 4 is hypersomnia. All right, so can we at least eliminate one thing from here? That's always going to be the way we are going to think about when we are not completely sure about what is the answer. And I know most of you are leaning towards early dementia. But what is something we can eliminate for sure? We will eliminate 3. She says mostly feeling tired rather than sad. So it's not about he's feeling like depressed and sad. His mood, when asked about the mood, he said, I feel so tired. But he's not sad, okay? He's not sad and denies any feelings of hopelessness or anything. So those are something which we will see with depression. So I can eliminate depression. The only thing which is kind of maybe there is a depression is less motivation and not doing things which he used to do. But that's probably because he's feeling so tired. It doesn't mean that he's having depression, because we know he says, I am not sad. He says, I don't have hopelessness. So that's not depression. Okay, so we will take that out. Number 1 is depression, and I will obviously eliminate narcolepsy too. Now, what is narcolepsy? I actually have a little more information here for those of you who are not familiar with it. We did talk about this sleep problem and sleep studies and everything in our class, so it's there. But narcolepsy is more like sleep attack. So without any warning, they won't be, have you seen narcolepsy patient? I had one patient and she scared me because I was a brand new nurse and I didn't have much information or any knowledge about what narcolepsy is or how the patients usually present themselves. I was taking her admission, notes. I was doing her admission paperwork and she was talking to me and suddenly she just went like that. Like within a second, while talking to me. It's not like, sometimes we watch a movie or watch something and we just, sleep. It's not like that. Okay. That's like hypersomnia, which can happen to us. But this narcolepsy people is like, it will be like this. I'm talking to you and suddenly I'm like, done. So that sudden sleep attack is narcolepsy. Our patient is not having that. Okay. And this can come with even other symptoms like muscle weakness, like it's called cataplexy. So they will be like, they will just go down. I mean, if they're standing, when the narcolepsy comes, they will fall. So, and they will have like vivid, very, very clear dream-like hallucination. So those are some of the things which can happen with narcolepsy. And it's not like they are excessively tired or like they are having this, super, they are like going into sleep, not like that. Okay, this is different. And this is uncontrollable. There is no control over them. What is going on with this patient here? The patient is, what all we know, the patient is sleeping longer than before, often 12 to 14 hours sleeping. Despite this, he's tired. No matter how much sleep he's getting, he's still tired. And he drifts off unintentionally while watching. He's watching TV and he sleeps off. And he's, conversing, talking, and then in the middle, he's like sleeping off. Okay, and several daytime naps. So he wants to take a lot of naps. He's like napping and napping and napping. Meaning like he's sleeping most of the day. Okay, and that excessive sleepiness is affecting everything, right? Because of, how do you feel if you're sleeping 12 to 14 hours, in a 24-hour period, and you're taking a lot of naps in between, you're always tired, you're always sleeping and still feeling tired, you never feel refreshed, what's going to happen? Of course, you will be tired, right? You will be like, if I lose my sleep, even one day, if I lose my sleep, the next day, nobody wants to talk to me because I'll be like, I cannot deal with anybody. I don't want to hear anything. Just leave me alone. I don't want to do anything. I don't feel like eating. I don't feel like cooking. I'll be like different person, right? So this guy or this patient is having that problem. So this is where we know this is all pointing towards his problem with excessive sleepiness. And we know the reason. In fact, if you really look into it, there is a reason given here. He worked permanent night shifts as a hospital security officer for more than 30 years. How is your sleep cycle going to be? You will be always awake during the night and you will be sleeping mostly during the day. Now he is having a problem here. That was his life for more than 30 years. Now, the answer here is 4, and hyper is always more. What is somnia? What is insomnia? Not having enough sleep, right? Or not able to stay asleep. Somnia meaning something with the sleep. So what is hypersomnia? Sleepy, sleepy, sleepy. Excessive sleepiness, especially excessive daytime sleepiness, where they are already sleeping for a long hours, but still they don't feel refreshed. They still feel like tired all the time. And they might take a lot of naps. And they feel groggy and confused. And that this is like jet lagged. Now, this is not early dementia either, because early dementia comes with progressive forgetfulness. So the moment when it is like 68 years old, or when you see that the patient is, one time briefly forgot the routine or the route to the store, doesn't mean that they are already in dementia. Okay? Do not jump into dementia because of the age or one memory problem incident. No, because when you are really, when it can happen with so many things, especially when you are having, just think about you being jet lagged. How are you going to remember things? You don't feel, it is possible for a 68-year-old to have that. right? And there is also so many things which tells you that in early dementia, it is going to be progressive. And you will see the memory lapses. And you will see that there is going to be other behavioral things which are also included. I mean, patients, the way they behave, the way they think, the way their judgment is, everything is going to change. But we have nothing like that here. Okay, so the client seems slower than usual, but responding to questions and is groggy after waking up from naps, but otherwise not much. The problems here is sleepiness. That is the most important thing here. It's all about excessive sleepiness. Okay, and because of that, our answer going to be hypersomnia. Okay, we good? Okay, and I understand that this can happen. Like those options can be so tricky sometimes, but we have to focus on what is going to be the best which we can put in, where all the information given is kind of included. Okay, so